Labis-labis ang panghinayang ni dating Presidential Advisor on Entrepreneurship, Joey Concepcion, dahil milyong-milyong doses ng COVID-19 vaccines na binili ng pribadong sektor ang inabot na ng expiration date. Sinabi ni Concepcion, Marso pa lamang ay hiniling na nila sa gobyerno ang expansion ng second booster shot rollout dahil inaalala nila ang nakatambak lamang ng mga bakuna sa mga bodega. Ayon sa datos ni Concepcion, higit 3.6 million doses ng Moderna vaccines ang nag-expire noong nakaraang Miyerkules, isang araw matapos ilunsad ng DOH ang pinaslakas ang pinaigting na vaccination at booster shot rollout program. Samantala sa katapusan naman ng kasalukuyang buwan, higit 623,000 doses ng AstraZeneca vaccines ang mag-e-expire na rin.
First and foremost, this is a vaccination program and we want to assure the public that there's a process for making sure that the entire program uses vaccines that are safe. We abide by evidence when we expand indications or use of our vaccines. And so with that as a principle, it got us to where we are now, which is 71 million Filipinos vaccinated, able to open the economy, not having issues with healthcare utilization, hospital utilization because of this cooperation that we've had with each of the experts doing their roles as well as the private sector supporting the government in the rollout.
Mahalagaan niya na nagtutulungan at nagkakaisa ang lahat ng sektor at ito ay nagresulta naman sa malaking bilang na ng populasyon sa bansa ang may proteksyon na laban sa mga malalang sintomas ng COVID-19.
So I think we stick to that principle of working together, each one having their role, checks and balances are available. And that's why we are able to be confident to tell the public that this is a science-based, a very safe vaccination program that we're running.
Aminado naman anya sila na may mga nasayang na bakuna, ngunit pagtitiyak lamang din ni Ho na ginagawa nila ang lahat ng paraan para mapalitan ang mga bakuna.
We recognize that there have been stocks that have expired and efforts are ongoing now to work with our COVAX facility because they will be able to exchange the expiring vaccines of the national government. And so inquiries are being worked out whether they could do the same for the private sector vaccines. In addition, in our conversations with some private sector partners, they have raised that their employees are more interested now to get vaccinated. And so the national stockpile is available. We can give it to them. They can manage the administration. But we can give them the vaccines.
Sa 71 million fully vaccinated individuals sa bansa, higit 15 million pa lamang ang nagpaturok ng booster shots, kaya't malaki pa ang bilang na hinahabol.
We still have a very low first booster coverage, 20% of those vaccinated. So ang dami pang pwedeng bakunahan. No? So it's not just about this policy that recently came out. But we can actually optimize the stocks to cover initially those for first booster. No? Pero ngayon, yung importante, we all have to work together, less sisihan, but actually working towards making sure that we reach the pinaslakas targets.
Sinabi naman ni Dr. Ana Ong Lim, isang infectious diseases expert, tunay na nakakapanghinayang na may mga bakuna na nasasayang. Lalo na kung babalikan ang pagkukumahog ng bansa na mabigyan ng donasyon o makabili ng mga bakuna. Ngunit anya, sa kanyang palagay ay mali na ibunto ng sisi sa gobyerno dahil may mga bakuna na nasasayang.
Ito bang pag-expire ng mga bakuna? Dahil ba yan ngayon lang in-approve ang second booster recommendation? I would beg to disagree. Kasi these are the same vaccines that were available for the first booster and even the primary series. So, hindi dahil sa ngayon lang in-approve ang second booster, kaya nagkaroon tayo ng expired doses. No? Kung hindi, dahil nagkaroon tayo ng gaps doon sa pagro-roll out or pagtanggap ng mga tao for their first dose, for the primary series, for their first booster, and of course, the second booster.
Pagdidiin niya, maraming maaring dahilan kaya may mga bakuna na nasayang at hindi lamang idiin ang lahat sa gobyerno.
Hindi dahil ngayon lang in-approve ang second booster kaya nagkaroon ng expiration. Maraming iba't ibang dahilan, pwedeng operational, pwedeng management ng supply chain, pwedeng acceptance ng mga tao, pero maraming efficiencies na pwede pa tayong gawin rather than saying, ay kaya nag-expire kasi ngayon lang inaprubahan ang rekomendasyon for the second booster. I think it's not very productive to focus on that. I think it's more productive to identify the gaps that led to why this happened. And those are the reasons or those are the problems that we need to resolve.
Escosio, Radyo Inquirer Online. Bayan nagtatanong, mamaya nag-uusisa.